Hi, everybody. It's been almost 3 weeks since my surgery. Today is Wednesday, the 6th of October, and I had my spinal fusion almost 3 weeks ago on September 16th. So I'll be following up with my doctor Monday, October 11th, and that's going to be my first ride in the car, my first trip out of the house. So just over the last couple days, I officially have a case of cabin fever. I'm stir crazy. It's the little things that I guess I'm finding out I took for granted before, like being able to get in the car and go somewhere. I'm missing that big time, big time. And my son plays Little League, so I haven't been able to go to any of his fall ball games. So hopefully when I follow up at the doctor's on Monday, I'm hoping he's going to let me at least go for little rides here and there. I'm ready. The pain has gotten better, I'd say. Um, definitely big difference from before surgery. I feel like the nerves that were pinched have been freed up, and I'm not getting the numbness in my left foot at all that I had before surgery. I do still have a little bit of pain on the left side of my butt, just a little bit. I mean, nothing like before surgery, and I think that those nerves are still healing. And then on my right side, I do still have pain on the right side of my butt, in my right hip, and at the top of my right thigh. And a little bit of numbness still going down into the foot. But I'm finding the numbness has improved, and apparently it's just going to take a while for those nerves to settle down because they were pinched for so long. When you think about it, it was almost exactly 2 years from the time I got hurt until the time I had surgery. So I'm trying to be patient with that. But I'm stir crazy. I'd love to be able to go out and go for a little ride. I've been able to walk outside, which has really helped. However, the last couple days, last night I ended up in quite a bit of pain, and I was trying to figure out why. And I'll tell you the truth, it was pretty discouraging because I hadn't really had that much pain since I've been home from the hospital. The ride home was horrible, but since I had been home, it hadn't really been that bad in a while, in a couple weeks. So I had to deal with some pain last night, and also I had been taking Advil, and I think my ulcer flared up again, so I'm having to knock out the Advil again because I really can't afford to have my stomach torn up and have a hole or an ulcer in my stomach. So as much as the Advil helps, I haven't taken any of it today. So last night I was trying to figure out why I was having so much pain, and I really think it's because the only thing that had changed was that I had been walking outside, and I had just been going down my street and back, but the couple days prior, to last night, I had actually gone around the block. And I think with the elevation here up on the hill that I live on, I think the elevation was just too much, and I see why the doctor said in his pre-op handout that walking is the best thing, but it needs to be on a flat, even surface. So now I understand, Doc. I understand now because it hurts. So today I haven't walked at all, but I plan on walking this evening because it feels great to get outside. The weather's perfect here. October, fall weather. Fall for Florida, of course, is 70s, but it's better than 90s. So anyway, let's see, little pesty things I'm finding are pain in the neck. It's, I have a recliner out here in the living room, and just within the last few days, I've felt like trying to sit in chairs. Until then, I've been sitting on high beds that are up on risers. So I thought I'd try to sit in the recliner, and it was actually pretty uncomfortable getting in and out of the recliner. So I don't recommend trying to get down into any low chair or chairs that you have to push and pull to get in and out of. It's just not worth it. I keep wanting, it seems like a bar stool would be the most comfortable thing, and I'm wanting to get one because it would be higher and you don't have to push yourself up in and out of it. So that's been pesty. Or annoying, I should say. And the other thing I found is, brushing your teeth is a bit of a challenge. I've taken my toothbrush and toothpaste in the shower and just do it in there because you don't want to bend over, that's for sure. Um, and I think I said in the previous videos that I kept everything at a level where I could reach. You know, I keep my shoes up high, my clothes. I have a little basket of clothes, the ones that I wear frequently, as you see in every video. I've got on some little tank top. So I've got my capris and my tank tops and underwear in a little basket where I can reach everything. Not really having to use the walker anymore. I'm steady and my feet, my legs don't feel like they're going to go out from under me anymore. So I'm able to get around without a walker, which is great. And the one thing that I'm still using that's coming in really handy is that grabber. Whenever you drop something on the floor, it's so nice to have. And like I said before, it's got that little magnetic end on the end of it, or magnetic tip. But I've dropped medicine, I've been able to pick that up, pens, pencils, remotes, whatever. So that comes in really handy. And I still find that when I'm having quite a bit of pain, what helps the most is to get a nice warm shower and just relax in the shower. And it seems like when I come out of the shower and go lay down, I get some relief. The other cool thing that I thought I'd mention is that for the longest time, it hurt me to lay like on my back with my knees up. After I first got hurt, I could lay like that. But then after a while, it became uncomfortable to be on my back with my knees up. So I was having to turn from side to side, side to side. And before, when my right side was hurting, the most comfortable spot to be in was on my right side with a pillow between my knees. So here lately, sometimes it doesn't give me much relief to turn on to the right side when it's hurting, but I found I can get on my back and put my knees up, and that's so cool because I haven't been able to do that in ages. So that's definitely a difference from surgery. So that's the update. I'll do another video here in just a second to show you my incision. The stitches are out and it's healing up fine. I don't have any problems with that. So what am I at? Almost 3 weeks. Tomorrow's 3 weeks post-op, and I'm doing really well. So I just wanted to share some of that hope with anybody that might be going through this. Take care. Good luck to you.